Now, there are people who may come from international, from other countries that are not trained here. If they bring certificate of completion from any college in their country, you know, they may be qualified to get into the program. And those that do not have, we have an entrance examination that they take, and if they pass, they'll be, you know, enrolled in any of the programs of their choice.
Looking to start a rewarding career? Call Gandhi Healthcare today to earn your certification as a nursing assistant, dental assistant, pharmacy technician, phlebotomy technician, and many more.
And Iwing Marketplace is the name of the platform, which is an online directory aimed at helping the African community to, you know, find information like products and services easily. So please, can you introduce yourself?
Well, thank you very much, Mr. Iwing. My name is Dr. Anna G. I am originally from Cameroon in West Africa. I'm a registered nurse with a PhD. I became a registered nurse in Bamenda in the southern Cameroons in 1989. And I've been a registered nurse since then up till now.
Wow, wow. I can see lots of experience. 1989 to
oh yes
2020. That's like more than I can't even count here.
31 years.
Wow. So I've been going through your Facebook, and I've seen your school, Gandhi School. That is a very beautiful initiative you set up. I would like to know what inspired you to set up such an initiative to help people become nurse and dentist technician and all of that.
Well, as a nurse, my passion is at the bedside. And taking care of patients and seeing them get well motivated me, especially when sometimes I get sick. When I'm lying in the hospital sick, I have my own students take care of me. It gives me great pleasure to see that, you know, you can actually impact the life of other people who turn around and also become your own caregiver. And so I figured out that for me to make this happen, I have to be able to, you know, to educate other people to become who I am. And so that inspired me to start transforming the lives of other people, beginning from the classroom, seeing them through the training, motivating them and helping them gain jobs in the healthcare field. And so I decided to set up this private career school called the Gandhi Care. It is approved by the Maryland Higher Education Commission, along with the Maryland Board of Nursing, the Maryland Board of Dental Examiners, and Maryland Board of Pharmacy, following the different programs that the students get certifications for.
I have so many questions to ask you. I don't even know where to start. But I'm intrigued with the name Gandhi, because when I hear the name of Gandhi, I think of Mahatma Gandhi in India. How did you come out with that name?
Oh yeah, you know, that's funny because there are some Indians that come to me just looking at the name, they think that they are coming to meet an Indian. And then when they walk in and I see an African woman, they're like, what are you doing here? How did you come about that name? You know, so actually that was not the Indian Gandhi that we all know. This one was a Cameroon Gandhi. And that was the name of my late husband. I don't know how he got the name, but you know, when you fall in love with somebody, whatever name that person bears is the name that you're going to adopt. So that's how the name came about. But naming the school after Gandhi was motivated by the nature of his death. He was one of the victims that lost his life during the rioting that was in Bamenda in 1992, following the presidential election. He was one of the unfortunate ones who was tortured to death. And so I just wanted to keep that name alive. And I was thinking of how I can make that happen. And you know how sometimes when you pray about something, God makes it happen for you. And so when the idea came about the school, I figured that if I name the school after Gandhi, then any student that completes from the training and obtains a certificate of completion will carry that name throughout their life, because they'll always think of, where did I get my first training? And the lives that they impact from the knowledge they acquire from the school keeps Gandhi alive. And so that meets my quest for keeping him alive.
Wow, that's nice. So when is the next session, or how is enrollment done in the school?
Well, enrollment is ongoing, and we do have different schedules and different class sessions. So depending on the program, they all have different time frame. The nursing assistant program is the shortest program for 4 weeks. The pharmacy tech is 10 weeks. Dental assistant is 12 weeks. The pharmacy tech is 10 weeks. I think I said that earlier. And the nurse support tech is 6 weeks. So it all depends on the program that the student is interested in.
So you just need to study for 10 weeks, 6 weeks, or 12 weeks, and then you're ready for the job market.
You're certified and you're ready to be employed. As a matter of fact, on the days that we celebrate graduations, employers come in ready to interview and to hire the students. So by the time they complete, we have their resumes, we have their cover letters, we get them ready for job interviews, and when those employers come in, they are ready for the job.
That is interesting. So how is the job market looking now with COVID-19?
Well, it is really in demand, because, you know, with everybody getting sick, everybody needs somebody to take care of them. And so it's a lot of demand for people to work in different fields, in the different areas in the healthcare industry. And so there's been a lot of requests for me to refer students who are doing well so they can be hired.
Wow. So how are you adjusting now that we have this situation where the social distances? How are you adjusting with your school program? Do students have to come in, or?
Well, we do offer classes both online and on-site. We use the Zoom for the lectures. We use the videos for the simulations. And then they come to school 1 day a week just for the hands-on practice. And we have reduced the number of students per class so as to maintain the 6 feet social distancing protocol. And so we make sure that the students have all the protective equipment, the mask, the face shield, and they practice mostly on the mannequin, but they really have to come on site just so that we make sure that they are able to practice the skills the right way. So we reduce the length of time that they spend in the class and the frequency of coming to class. Most of the training is done online. And the pharmacy technicians and dental assistants, they don't even come to class. They just go straight to the pharmacy for their externship after the classroom instructions, and they are ready to, to be employed.
So who can take those courses? I mean, I know, there's so many people who are looking for new opportunities. Who do you recommend your program to?
Well, the program is open to the general public. Anybody who is 18 years and above is able to attend, most especially those individuals that have either the GED, the high school diploma or transcript, or any college education, is able to enroll in the program. Now, there are people who may come from from other countries that are not trained here. If they bring certificate of completion from any college in their country, they may be qualified to get into the program. And those that do not have, we have an entrance examination that they take, and if they pass, they'll be, enrolled in any of the programs of their choice.
Wow, that's very interesting. I mean, this is like very vital information you're just giving right now, and I really do hope so many people get to see this and make use of this information. So apart from teaching, I realize you are into entrepreneurship. Can you tell me more about that?
Oh yeah, I attended the John Hopkins School of Business Administration, and so I learned I acquired a lot of knowledge about business in nursing. And so I do help people that want to start up their own businesses in the areas of starting a private career school, or you want to start a home care agency, or you want to start up a what do you call it, a mental health facility like clinics. I do help people set that up. um, any area that has to do with setting up according to the coma regulations. I do consultancy for such businesses.
That's really nice. I mean, right now, so many people are home thinking of, what kind of business they can create for themselves. What do you think is holding people back, for them to start up their own business?
Well, some people are just afraid. Some people are not ready to take that risk, but some people may be financially not up to, not up to date, and they are not sure of whether they'll succeed or not. And so some people just don't have the courage to even dare it. And there are many people who want to do it, but they don't know how to go about it. So I'm here to encourage everybody that you cannot know if you succeed if you don't try. And that if I could make it, if I could try and I succeed, then everybody else can, because I come from nowhere to where I am today. I'm not boasting that I have too much, but I think that um, I've come to the point where I can say that I made it happen.
So I see Gandhi's healthcare, right?
Yes.
Also provide assistance to patients, right? So does that mean like you hire CNA workers, or how does it work?
Can you hear me?
Yeah, I can hear you.
Oh,
So I'm
yes.
asking,
So,
like, apart from the school and apart from you helping people to set up their own business, right? I
yes.
saw something on your website like Gandhi Healthcare also provide assistance to people who need like healthcare workers.
Yeah, we do have a home care agency. We hire some of our students. We have clients in the communities that need healthcare services. So we assign some of our graduates to go and work for them, providing care in the individuals' homes. So yes, we do assist with job placement.
That's interesting. You're not only training people, but you're making sure that they have a job. I love that. That's a
Yeah.
very good model. So there are so many people back home who probably interested in the program, but with COVID-19, they've lost their job and, maybe facing some difficulties like paying the entire fees. Do you have like a payment plan, or how does it work?
Yeah, we do have scholarship programs for people that qualify. We don't have control over how those agencies qualify the students, but we provide the information and the students will go ahead and complete the application. If they qualify, those agencies will sponsor them. If not, we have an instrumental payment plan, so they can choose whatever payment plan suits them, but we just have to make sure that they complete the payments before they graduate from the program.
That sounds good. I mean, I think this is encouraging, and I think a lot of people will try to benefit from this, by applying for the scholarship. How can they find the information for the scholarship?
Well, if they go to our website, www.gandhihealthcare.com, they can obtain that information, or they can call the school at 443-352-8030, or, they Google us online and they can find Gandhi Healthcare, and all that information is there.
Okay. So what's your number one advice for, all aspiring Africans, who've just moved to the US and they don't know which career route to go, what advice do you have for them?
Amazing. I'm not going to be selfish here, but I'm just going to spit it out the way it is. Most of us migrate to the US in search of greener pastures. And I know that healthcare is very, very lucrative. There are so many specialties, especially in nursing. It is so broad. You can choose to be whoever you want to be. You be at any level. It is you to set your own limits. Especially in nursing, there are so many specialties that you cannot never feel bored or burn out doing the same thing every day. You get tired of one specialty, you can switch to the next specialty. If you want to carry on a project at home, you can push 16 hours every day, Monday through Sunday. Within a month, you're going to raise that money and be able to carry out your project. So I encourage everyone to please get into the nursing field. It's not just to make the money, but it's just seeing that you're able to take care of somebody and the person gets well. And most especially, the knowledge you acquire from the program is not only used to care for people, it's also used to care for yourself, your family members, and your close friends. So I know there are other fields out there, but I'm going to speak for my own field. I am very proud to be a nurse, and I encourage everyone to be same.
Thank you very much. This has been very, very beneficial to not only the people watching, but for me as well. I've learned a lot from you. I think we probably will have another session where we can, talk more, because I see you have a lot of insight about, making it in the US. Thanks so much, Dr. Anand G, for giving us your time today.
Thank you very much for the opportunity. I don't know if you went the way I really wanted.
To start a rewarding career? Call Gandhi Healthcare today to earn your certification as a nursing assistant, dental assistant, pharmacy technician, phlebotomy technician, and many more. We offer no interest payment plans, scholarships, and tuition reimbursements for those that qualify. Located right in the heart of Pikesville on Reisterstown Road and McHenry Avenue in the Pikesville Shopping Center. It offers immediate access from 695, accessible to public transportation on the 83 and 89 bus line. We offer morning, evening, and weekend classes to fit your schedule. Earn your certification in as little as 5 weeks. We are now offering classes online and on-site. Hurry, classes start soon, so enroll today. Visit us online at gandhihealthcare.com or call 443-352-8030.